I'm Dr. Christopher Creighton. I'm with Texas Pain Physicians, and I've been with that group almost 2 years now and have been in pain management practice for 33, almost 34 years. Pain in the sacroiliac joint can come about for a number of reasons, usually involving some trauma to the joint. Sources of trauma include obvious things like falls and rear-end collisions and cars. To treat the joint, we usually start with injections of the joint. We limit ourselves to up to 3 of those joints, by which time we figured that is not going to provide long-term relief if it does not. Over 90% of people get adequate relief from those injections, and we stop with that. So the surgical technique for this procedure is fairly straightforward. It involves first identifying the location of the joint under fluoroscopy, which is like X-ray on a TV screen. Once you identify that, you make a small incision and place a K-wire, which is a stiff wire, into the joint, and then 2 sets of dilators to spread the soft tissue apart down to the joint. At that point, you can run a drill into the joint, which makes a small hole the size of the dowel that you're going to place in the joint, and rasp that out, which roughens the surface of the bone and stimulates the growth of your own bone cells into the peg, as we mentioned earlier. Following that, we take those instruments out except for the dilator, put the peg in, and pull the dilator and the placement instrument out, and we're done. So I've been using the Genesys Spine system for quite some time now, and it is one of the very few, if not the only tool that I have to treat pain for which I can say the results have been 100% so far. We've had no treatment failures, and to me it's very odd when I have a patient that I have to do both sides on. We have to wait about 3 to 4 weeks in between procedures, and I've had patients come in for their follow-up visits begging for me to do the other side, and I've never had anybody beg for surgery before. So that reflects really well on the success of this procedure for patients. It truly increases their ability to participate in normal daily activities and their workload. So I've been very happy with that.